Everyone loves the aesthetics and beauty industry, but you never get to see everything behind the scenes. It's for authorized personnel only. But now, you're being authorized.
We are in the operating room today, and we have
Blow the dice for me. Put your pretty ass lips together, blow it real nice for me. Yeah, I'm trying to hit a lick and slide to the dealership in the morning. Wow, Papa need a brand new foreign. Hot head, they not gonna believe it, but check the recording. Just us dance, up a few bags. Big booty hoes meet me in the penthouse. Bar full of liquor, cash for the strippers. It's gonna get weird tonight, so no, just some money to blow. I'm about to buy Las Vegas after this road. I'm about to buy Las Vegas after this road. Come on, 7, 7, 7. Let's go. Yes,
Welcome to Naked Beauty Live. We have a great show. We've got two fantastic guests, and if you don't already know, it's International Men's Day. That's why we are talking all about male aesthetics today. This show is all about cosmetic procedures, surgery, products for men, celebrating International Men's Day. So it's a great program you're going to have today. And we've got terrific guests. Before I get to the guests, I want to talk a little bit about male aesthetics because, I am a professional when it comes to male aesthetics. We have a lot of men in my practice. Actually, the average practice has about 6 to 8% men. In my practice, it's closer to 18 to 20%. I don't know why, but we have a pretty good representation of men as patients. Now, if you are thinking about the topic of male aesthetics just worldwide or nationwide, between 6 and 7% of all cosmetic procedures are done on men. And that amounts to a pretty good number of procedures. There were over 100,000 cases done in 2023 on men, over 100,000 surgical operations, not counting all the non-surgical stuff. Now, non-surgically, Botox is not just for women. We've got a lot of male patients that are Botox patients. And in fact, there are a lot of famous people that have had Botox done. Right now in the news, Matt Gaetz is one of them that maybe isn't the best example of the right way to do it. He had kind of the Spock eyes, or kind of looked like a Who from Whoville. But that's an example, maybe not the best result. But now another guy that had it done and shared it with the public was Coach Prime. Deion Sanders had Botox done. So even athletes, these big macho guys, are having it done. Everybody wants to stay looking young and fresh. And so cosmetic procedures, non-invasive, invasive, all help keep men looking great. So let's take a look at how that's grown over the years. Between 2019 to 2022, the number of procedures done on men has tripled. It's more than tripled, over 200% growth. And that's not only surgical procedures, which is astounding that there's been a tripling of male surgical procedures, but there's also a tripling of non-surgical procedures. Botox is almost quadrupled. It's the 250% growth in the same time period. So that is a lot of guys getting Botox and staying fresh. So taking a look at some of the surgical procedures, like what are the top things that guys get done? Well, number one on the list is lipo. Right? Lipo, 25,000 procedures were done on guys having lipo, and I think that's probably a low number. It's probably an underestimation, but in the accounting, the statistics we have, 25,000 procedures, it accounts for 6% of all lipo. So there's an astounding amount of liposuction being done on women, but of all the procedures done, liposuction, 6% are done on men. Famously, Kanye West had liposuction done and shared it publicly. Gynecomastia, all those procedures are done on men. That's when you're removing the female breast tissue in a man, or just breast tissue as opposed to just fatty tissue in the chest. Men have breast glands. If you didn't know that, now you know. Men have breast glands, and if they get a little too big, it leads to a condition called gynecomastia, which is basically the female form of a breast in a man. And that is bothersome for a lot of guys. There's different ways to treat it, and one of the ways to treat it is surgically. Just remove the excess tissue. And when we remove the excess tissue, that operation will make a chest nice and flat. And when you do that, that cures the problem. It does not come back. So gynecomastia, 21,000, almost the same number of men had gynecomastia surgery as had liposuction done. And of course, 100% of those procedures are done on men. Now, a famous example of this, The Rock, Dwayne "The Rock" Johnson, had gynecomastia surgery, and he spoke about it publicly. Eyelid surgery. Eyelid surgery is really popular among men. In fact, there's a significant number of men that have eyelid surgery in the total population. Almost 15% of all eyelid surgery done in the United States is done on men. And so a famous example of that, George Clooney. George Clooney wanted to look a little fresher, to stay looking a little younger. He had his upper lids done. Ear surgery. This surprised me when I was doing research for the show. Ear surgery, that affects men, women. It's when you have the prominent ears and they stick out, and people call it ear pinning. The medical term for it is otoplasty. Otoplasty, 1/3 of all otoplasties are done on men. That was surprising to me, but it makes sense. I think probably it occurs about half and half, because there's no real reason for men to have more prominent ears than women. Just genetically, it should happen at about a 50% rate, but women are still a little more likely to have procedures in general, so only 1/3 of otoplasty seems to be done on men. Facelifts. We see a lot of facelifts, and this is something that's growing. We're going to talk about this on the show a little bit later when we get our guests up. Facelifts and facial rejuvenation in general is a really hot topic and has been growing in the male population quite a bit. And a great example of this is Marc Jacobs. Marc Jacobs had a facelift done and shared it very publicly, the whole thing, on Instagram, all over social media, and he looks great. He was sort of a poster child for getting rejuvenation with a facelift as a man, and he shared it. It was really great. Neck lifts are another part of that. Neck lifts are a little different from a facelift, but it's a very similar operation, just a slightly smaller operation, doing only the neck as opposed to doing a facelift. Facelift includes the face and neck. Neck lifts, about 12% of all neck lifts done in the United States are done on men, which is a pretty big percentage if you're kind of following along and seeing what portion have done on men. And then if you put chins in there, about 1/3 of all chin augmentation happens in men. And we're going to talk, we have an expert in facial implants on the show today, an expert in male aesthetic implants on the show today. This is an interesting thing. You probably didn't think about this, but not only women get breast augmentation. 1% of all breast augmentations are done on men. In fact, there's about 2,000 men that had breast augmentation done. Of course, that's not surprising with transgender issues being in the front of the news quite a bit. And so there's about 2,000 men every year that have breast augmentation. Now, there's a difference between a pec implant and a breast implant. We're going to talk about that later on the show, too. Rhinoplasties, nose jobs, 1 to 2 out of every 10 are done on men. So, 10 to 20% of all rhinoplasties are done on male patients. It's a very popular operation. It's one of the big ones for men. And hair transplants, hair restoration, is a huge topic. A lot of places are doing hair transplantation, but a far less than you might think. It's a very popular procedure for men. You hear a lot about people going to Turkey, going overseas to have it done. There's a lot of it happening here. We do it in my office. I take care of a lot of men for hair transplants. And it was shocking to me to find out the statistic that only about 2% of all cosmetic surgeons offer hair transplantation. That's a tiny amount. I would think so many more people are doing it. But it is a pretty specialized thing, and we'll do a little talking about hair transplantation on the show. So that's a little taste of what we're going to get to on the show. We've got 2 great guests coming up. We're going to be introducing our guests. I've got Dr. Doug Steinbreck on the show. His whole practice has to do with male aesthetics. And we've got Dr. Shinobe Aguilera. He is a dynamo whirlwind for aesthetics in general and has a ton of male patients and really can speak to the male aesthetic. Before we get to our guests, we're going to take a short break. We'll be back after this. If you're thinking about having discount cosmetic surgery, we're talking about going overseas, maybe going to Turkey for hair transplants, be careful. Sometimes price isn't the most important thing. We'll be right back after this message.
I really have to get home, but these ride shares are so expensive.
Try Oh Boy. Get an Oh Boy whenever you need a ride to go anywhere, and we guarantee you'll have the cheapest price because nothing else matters.
I'll order a car now.
Simply download the Oh Boy app and request your ride, and our driver will be with you momentarily.
Esther?
What's that?
Esther!
What'd you say? Speak up. I'm deaf in one eye.
Esther!
Ask her. Ask her what? Get in the car. I don't have all day. Download the Oh Boy app today, and you'll be on your way to getting the cheapest ride possible.
Caleb?
I only have one hour for recess. Come on!
I need to get to the airport. Are you sure you know how to get there?
I have GPS. I gave up my snack time for this.
It may not be the most comfortable ride, and you might not have the most professional driver, but oh boy, the price will be right. I've got a little bit longer. There's a little bit more to the commercial. Don't cut the commercial short, Joe.
Price is right.
Download the Oh Boy app today, because price is all that matters. When price is all that matters. All right, well, we're back, and it's time to introduce our guests. I want to introduce first Dr. Doug Steinbreck. Dr. Steinbreck is practicing in New York City. Doug, welcome to the show. It's great to have you.
It's great to be here. So happy to be able to participate.
Well, I'm honored to have you on here. I can think of no one better that I would want to have on the show to talk about male aesthetics. And your whole practice is about male aesthetics. I mean, in fact, it's the name of your practice, isn't it?
Yeah, Alpha Male Plastic Surgery. That's the name of the practice. Yep.
Pretty neat, man. What made you choose that, and how did you get that niche for you?
Yeah. So what happened? It happened probably about 2010, 2011, when I started my practice. I've been in practice for about 6 years, and I was doing breast augmentation, mommy makeovers, like everybody on the Upper East Side in Manhattan. Just had finished up at NYU. And I started to have more guys. I had friends that I was doing abdominal sculpting on them, and they would ask, "Hey, do you do any submental liposuction? Can you improve my neck?" And then they'd start to say, "Could you put in a pec implant?" And I'd never done it before, but I learned how to do it. And then my staff would come back and said, "That guy with pec implant, he wants bicep implants, and then tricep implants." And then after a while, instead of just coming to my desk, my staff would just go, "Well, forget it. We'll book it, and then you'll do it." And so we just added on. We went bicep, triceps, ab implants, calf, quad implants, glute implants, shoulder implants, pretty much anything. And it's just continued on from there.
And just organically developed that way, huh?
It organically developed, and what happened is we educated. We made a website for men because my patient coordinator said, "You have to do this. We need to do that," and that went viral. And then we cut and pasted it. We took down the buildings in New York. We cut and pasted the Beverly Hills sign and a couple of palm trees, and then I started my practice in Los Angeles. And then we did the same thing for Chicago. So we've been in Beverly Hills now for 8 years, and then Chicago for 5 years.
It's not surprising to me that grew so quickly because there's so few doctors that have a real knack and an interest and specialization in taking care of guys.
Yeah, you're right. A lot of practices, honestly, when a man comes in, everybody sort of like cowers and runs and hides, and we're sort of we love the dudes. We know how. It just comes. Our staff's very comfortable with them. They know how to interact with them. There are a lot of men on our staff. Doesn't have to be that way, but they just are. And we love our guys, and I think they understand that we know how to treat them and support them, and I think that makes a huge difference.
So, do you make your office a man cave or a broasis, as you would?
You actually don't need to do that. Like the guys in New York and LA, they're pretty sophisticated. I think it just needs to be contemporary, modern. Actually, in New York, it's on Park Avenue, so it's more sort of old school, masculine, sort of clubby appeal to it. But in Los Angeles and Chicago, it's very modern, it's very austere. But it doesn't, you don't have to, just like for the women, you don't have to put necessarily, the butterflies and the orchids and the flowers anywhere anymore. It's not the 1980s. People are more modern. So it doesn't have to be that. It's just really about providing good service to them. So they're definitely, the whole idea of having the man cave with the Hooter chicks is not really necessary.
Well, if you're only dealing with men, you don't have them as patients, so they wouldn't be
Right.
around otherwise.
Right,
Well, let
exactly.
me take a moment. I want to introduce our next guest for the panel. This is introducing Dr. Shino Bay Aguilera. Dr. Aguilera, or Shino, as the whole world calls him, is a dynamo throughout the world. He and I see each other lecturing all over the world a lot, and I will say Shino has a tremendous following. In fact, his career has taken a turn to sort of an holistic approach, more of an inward to outward approach. And he's been taking care of men and women for decades and can really speak to differences between the aesthetics. And, one thing that really impresses me is, first of all, Shino takes incredible care of himself and he practices what he preaches. So much so that every time we're at a conference together, Shino gets up and he leads a yoga session. It could be like 5 in the morning, which is why Shino, I'm sorry, I'm never there. But he really does an amazing thing and leads yoga, teaches all sorts of aesthetics throughout the world. So Shino, welcome to Naked Beauty. Thanks for coming on the show.
Thank you for having me. I'm excited.
Yeah, really great to have you, man. So, you heard me talking with Doug about the male aesthetic, and you've been taking care of men for a long time. And as a cosmetic dermatologist, your specialty has always been male facial aesthetics. And we've both actually taught courses together, given lectures in sessions, speaking about taking care of men specifically. So, how did you take a personal interest in, and what percentage do you think of your practice is men?
Usually, I think probably in my practice might be about 25%, which is more than what is expected um, in in the analyticals about the total male aesthetic patient that usually is around 17%, 16 to 17%. I got interest of doing male when I actually did a really nice project with Allergan. We went to several major cities in the United States, and we were in one of those two-way mirrors, the one they use like when you commit crimes. Um, so we were behind the mirror, and they were interviewing heterosexual men because Allergan was very interested to see why, after all these years, that needle doesn't move as far as we should. He said because heterosexual men don't care about what they look like, or but we actually found out that they do. We found out that 46% of male patients on these studies were unhappy with the way they look. 66% said that they were doing cosmetic procedures because they wanted to be competitive in the workforce. We found out that 80% of them care about their crow's feet more than they care about the wrinkles on the forehead and the glabella. And the major thing that we found out was that heterosexual men care about what they look like, but most of them always feel that they need permission from their girlfriend, their wife, or they have a friend that is a guy's guy that's doing cosmetic procedures so they can justify to be in the waiting room waiting for a cosmetic procedure to happen. That's what we found out years ago about
Does
this
that
study.
still hold true though? Do you still see that trend? Because I think it's become a lot more accepted.
It's more accepted with the new generation. I think the millennial generation, they're more open about doing cosmetic procedures than somebody like me, like a petty baby boomer, Gen X, you know?
Yeah, well, I see a lot more men showing up. It's becoming less taboo, and certainly I've seen that transition. Let's get all three of us together. Doug, I want to know what you're thinking about. You're listening to the conversation about how things have changed over the years. Shino and I have both seen it. You're only seeing men, but have you seen attitudes change?
Yeah, I've seen it. By the way, I was in that room with Shino when we had the double glass. So that was probably 12 years ago. I think that was one of the first times I met Shino. It was a great experience. Yeah, how things have changed. Things have changed because our society is more open. It's a couple of different things. there we now have social media. So everyone is just sort of throwing up everything on social media. So there isn't so much of a negativity or a problem with talking about these things because everyone's talking about everything. There's so much noise out there in the universe that people don't really care. They're not so worried about someone finding out about it because everyone's on their screens and everyone's obsessed with their own Instagram. So that's one thing. The other thing that's changed is with this social media, how you look and how you present yourself is much more visual, and it counts a lot more. And people are more likely to stay connected. Started with Instagram. You only saw your friends from high school when you're getting close to your 15th or 20th reunion, and that's when you really cared about it. But now you're competing with all your friends from high school if you stay in line with them every single day. So people are really concerned about that. They want to stay looking good. The other thing that's changed is people need to be younger for their jobs, and they Shino hit on this. They need to look better in the boardroom, and that makes a much bigger difference. But the last thing is the advent of the superhero. So everything with our media now, with our movies, you can't find a good character-based drama anymore. Everything is going to be a Marvel or DC comic, and so all these guys have ripped abs. They've had jawlines. And this whole idea that all this, it's sort of become heteronormative now. Now it's cool for straight guys to have abs. It's okay. They can take off their shirt. If they don't go into the locker room and flex in front of the mirror, then they didn't really work out. It didn't count.
Dude, you're going to change my whole behavior in the gym now. I don't know. Now I got to do things completely differently.
Exactly. So with all these things going on, and it's just more open. We're seeing a lot more of this. There isn't that stigma that men used to have with plastic surgery.
I think the stigma in general has gone down. Just stigma, the idea that plastic surgery is somehow exclusive, or even cosmetic procedures, not just surgery, like injectables. So let's talk a little bit about injectables and differences between men and women. Shino, this is your wheelhouse. And I've seen your talks on differences between men and women. Give us the highlights. When someone comes if you go to a less experienced injector, let me put it this way: if a man goes to a less experienced injector and they try and get some kind of rejuvenation, just kind of a refresh, the last thing a man should have is the same type of facial lines as a woman. Feminizing a man's face is not a good thing. So give us, everyone watching, what should they look out for? What are the highlights of a male face that are different than a woman's face?
Yeah, and that comes to understanding sexual dimorphism and also the rheological properties of the products that you're gonna use to trying to enhance the male features. So, for example, there's 3 bones on the face that are signs of youth, beauty, and fertility, and signs of attractiveness. But they have sexual dimorphism. They have different angles, and the way that you work on this area has to be completely different from male to female, unless you have transgender patients. In this case, we can help them feel the authentic self. So those 3 bones.
But what you don't want to do, though, I'm sorry to interrupt, but what you don't want to do is take a heterosexual male patient and treat them as a woman, because that makes them look transgendered.
Exactly. Weird, completely weird.
Right.
So the 3 bones would be zygoma and zygomatic arch. That's 70% of male and female beauty. And then the other 30% is shared between the chin and the ramus of the jaw. The chin is very important because on the primitive brain, it can send messages that something went wrong in utero. A lot of people do not trust, and not to offend anybody out there, but a man with a weak chin is not trustworthy. That's the message that give to the observer, right? For other reasons, but unfortunately that is true. And having a man with a very strong ramus of the jawbone that looks like a superhero, it is very virile, and it shows strength, right? So all these areas, when we work on a male, we have to make sure that the angles are right, like the angles or the rim of the jawbone on a man is more square than obtuse like a woman. On a female, there's more of an angle. So when I work on a female, I try to be on the superior aspect of the zygomatic arch in an angle. And the male, I try to be a little bit more in the middle and back without that much of an angle. The width, when I work on a man's chin, is the width of the mouth.
Right.
In a woman, is the width of the nerve or the medial canthus. Men also, the rheological properties of the filler is important.
Right.
So the higher the G prime or the filler, the better is for a man. So I always say like a stiff man is good to find for a woman. But if it's not that, because if it's that, it's a terrible thing. But or hard things are good for a man and sometimes for a woman. So that's the way I teach my residents. So if I'm gonna use a filler for a man to work on this area, it has to be very stiff or very hard. Like I will never use Voluma in a man because it's too soft, too feminine. I will use, if I'm gonna use an HA, I will use left, but I usually like to use, since I'm more into bioregenerative and
Right.
things that turns, I will use calcium hydroxyapatite, known as radius, because it gives me the best straight angles and trying to keep the jaw straight and strong. And on the frontal view, the ramus of the jawbone and the lateral displacement of the zygoma should be on the frontal view at the same level. Those are the things that I look into when I do a man versus a woman. And a quick thing that I do is that at glance, a man that is aging and or enhanced, I need to make sure that if it's getting oval, to make it back to rectangular or square.
So, Doug, you do a lot of implants as well. You know, jaw implants, chin, just facial shaping with permanent implants, as opposed to using fillers, which, you know, they need to be maintained. But the consideration's similar, right? When you're looking at someone, what are your thoughts? You agree, disagree? Any other pointers for men's face?
Yeah, I would say, well, the thing is that the implant is for shape of implant. So a woman's implant may be more centrally located with more projection. A man's, we're going to square it off. A lot of times I'm taking the implants and I'm shaving off the center of it to square it off. The jawline implant will add more volume. And now there's one key thing that I want to make clear. There's a misconception that, and I'm sure you've all heard this, I want to do injectables and then ultimately I want to try it out, but then I want to switch it to a permanent solution. Well, the fact is implants are better for volume, but if you want to really get close to the dermis, you get really sharp, really refined, get really good structure, you're going to want to have an injectable anyway. And I talked about a composite. I talk about the cake and then the icing on the cake. And when you have a big wedding, you have a beautiful, you spend a lot of hundreds of thousands of dollars on your wedding, you don't push out this cake that has no frosting on it. And what we do is when we use a composite, the thing is the filler, many times I will say, you need volume. So you do need a ramus implant. You need a jawline implant, or you can get more volume with a chin implant. But to really make that sharp on the sides for the jawline and run across the edge, because the implants, keep in mind, are so deep, they're so close to the bone, that it's not going to be as sharp unless we put some injectables on top of it. Same thing with cheekbone. I can get a much sharper, high Nordic cheekbone in a man if I use a filler rather than just a volume from a cheekbone very deep. So there's a misconception. So if you're a patient and you want to have that sharp, sculpted Brad Pitt jawline or a very high cheekbone like one of these superheroes, then you may think that you're going to get it, and you may be disappointed from putting in implants if the implants are too big or you have too much fluffy, sometimes fat or just redundant interstitium in your face, in your facial structures that are going to cover it up. And keep in mind, I tell people, you may think that you're going to look like Brad Pitt, but you're going to look like Marlon Brando in The Godfather if the tissues aren't right for the implant.
Yeah, I often use the Marlon Brando comparison when patients keep coming back for more and more, because particularly with filler, more is not always more. People like their result early, things look great, and they think, oh, this is great, and I just want a little bit more. I'm just going to go back and get a little bit more. But stacking and adding more and more volume just screws up the ratio, screws up the proportions, and exactly what you guys are both talking about, that chiseled look, getting that definition. And it's just a common mistake we see. So I often mention to people, especially in the angle of the jaw, where you're trying to get that beautiful shape, really sharp angle, a little bit of flair in a man. Adding too much will make you look exactly like that, just jowly and like Marlon Brando.
Absolutely.
Now, there's a difference also thinking about men and women. We're talking about breast implants versus pec implants, and there was a famous case in Miami of a guy that thought he was a plastic surgeon but wasn't a plastic surgeon and wanted to get pec implants, and this charlatan ended up putting in breast implants into the man as pec implants, and as we all know, that ain't gonna work out well. And it didn't. And so it's a really different thing. Now, I don't do pec implants because it's a painstaking process if you're going through the whole thing of customized pec implants, doing the impression of a chest, getting customized implants designed. A guy like you, Doug, that does so much of it, you probably can analyze this and take standard implants and make them work. And so talk to us about the difference between, obviously, a breast implant's filled with gel. Pec implants are solid implants. So tell us a little bit of the differences looking at the two operations, and then the high points of what a male chest should look like.
Sure. And I have seen a couple of patients. One came from South America, another came from Europe.
Thank God you didn't say Miami.
No, had women's implants, and they weren't even under the pec. They were
subcutaneous.
On top of the pec. Yeah, if you can believe that. So it looked really horrible and very feminized, looked like a trans patient. So yeah, we do see that. What are the difference between male pec implant, which, as Adam said, it's solid, and you actually can custom carve it, which I do many times, to fit your own natural anatomy. So you don't necessarily, because these the ones that are made with that are subtraction studies with CAT scans, those can be very expensive, $20,000 for an implant. So we can make it much more affordable if we use standard implants, which will fit 95% of the patient population. And I'm a big fan. I love implants so much that I bought one of the companies. So that's my disclosure. Alpha Aesthetics, my company.
There you go.
But the reason why I bought them is because they're wonderful, and we need more men's products. So that's why I started the company. That's my disclosure. But the implants are solid, so we can trim them. Versus breast implants, as most people know, have a shell, a soft shell, but then are filled with this goo, so that they can rupture, or they're filled with saline, they can rupture as well. But these implants, the pec implants, don't. Also, in terms of position for male implants, and we're going to have you start doing these implants. They're so easy. It's just an incision underneath in the armpit, and it goes right to the lateral border of the chest wall. And then it's just like a sandwich. It's like putting bologna in between two pieces of bread. It goes between the pec major and the pec minor, and there's a bloodless plane, and they're beautiful, and I love them, and they make so many patients happy.
It's actually the same plane. If you're doing a transaxillary breast augmentation, it's the same plane, the same incision. Just go in there, and it's bloodless when you separate those two planes of muscle. But, before things were refined, I mean, it's only recently that we have good choices. I'm glad, guys like you that have really worked out the aesthetics of it and the science to make products that are easier to use so that guys don't get breast implants as a chest implant. Butt enhancement. People think of a BBL as the same for everybody. You're taking fat somewhere, you're stuffing it into the butt. And if you're not doing it with fat, you can do it with injectable. Sculptra is commonly used. A lot of people are using mixes of Radiesse. Shino, you mentioned Radiesse before. Mm-hmm. Have you done in your practice the Radiesse or Sculptra augmentation of butts?
Me? Or
well, in the practice, in the office, I know you've got.
In the practice, yeah, not a lot of men, but definitely I've done both with Hyperlip Radius, with with Sculptra PLLA, and now with Renuva, or a combination of Renuva and Sculptra to maximize the results. Getting results. I mean, it is a very expensive procedure that needs
Yeah.
to be maintained. So
Yeah, that's the thing. Using injectables can get very, especially with Renuva. It's a new product. What we're talking about, Renuva is a product that it is kind of engineered fat, and really what it ends up being is a scaffold that allows your fat to form and overtake the volume that's been added, and you kind of retain that volume with your own tissue. It's a great concept, but it's such a new technology that it's very expensive to do, especially in large quantities. I mean, right now it's a good option probably for face, but not so much in the butt or in the breast, where we need bigger volumes, because it just gets. I mean, you could spend $40,000-$50,000 to get any amount of augmentation.
easily,
Yeah.
yes.
So, thinking about the shape of the butt, though, the aesthetics of a male butt versus female, it's very different. Now, I've done BBLs on men as well as women, of course, and the shape is very different. In a woman, we're looking to have something that people talk about, a heart-shaped butt, where it's a little bit rounded and full in the base, and it kind of rounds out to the bottom and gets softer towards the base. Or the inverted heart, so that you've got the fullness in the base that's rounded, but still a firm projection in the center, and then kind of tapers up to the top. It's very different than what you want for a man. That would be exactly the wrong thing to do for a guy. Guys have to have a very muscular look. Doug, do you ever? I know you're big on implants in the body. Do you ever use butt implants in male patients?
Absolutely, yeah. We use gluteal implants all the time. We do injections. So I've done Renuva, I've done Radius, and we've done even hyaluronic acids, if you can believe it, and Sculptra in the glutes. So we've done them all. But to really get volume, it's the best way to do it. That's cost effective is either going to be your own fat.
Right.
We use all subcutaneous to keep it safe, and then or to use an implant. So the same thing. Implant is going to be intramuscular. It's within the gluteus maximus through 2 incisions, and it's sort of like if you get those expensive hamburgers that have the blue cheese in the middle, that kind of thing. That's where the implant goes. It just goes right in the middle of the muscle, and it covers it. It gives great coverage, and also it's less palpable, which is what doctors speak for, is saying it's less feelable to people who are
Right.
touching it. So but gluteal implants are fantastic. They're tricky. They have a learning curve, so there are not a lot of doctors that do them. I love them. We use them all the time. The key thing about it also is the shape. So as we were alluding to, for men, and I actually have a gallery of guys. So there are 5 guys, and you can sort of pick your rear end by looking at the shapes. And number 3 is always a hot seller. Everybody wants that. There's usually more athletic, somewhere in between. Number 1 is going to be very rounded, and I sort of call it a rounded Speedo bubble butt. You just want to run up and sort of grab it with both hands. And then on the far side to the far right is the gentleman has a very athletic bodybuilder. We call that a hip dip. And it's a very
Right.
sculpted look. So but most people want somewhere in between. They want a little bit of rounded, not so hard, not so strong as that. But keep in mind, these are for our men that aren't transitioning, or men
Right.
that don't have an act downtown that starts after 11 p.m. None of them want a Kardashian. None
Right.
of them want a diaper butt. None of them want anything. You can't even bring up the K word, because
Right.
nobody wants anything that's too hippie, and we take that completely out of the
Right,
equation.
but it's exactly right. I mean, it's the opposite. You were talking about the hip dip that so many
Yes.
women can't stand. They come to get that
No.
eliminated. But that's the key to keeping a male butt looking
Very
athletic,
vascular.
is to have the border of the muscle, to be able to see the contour that all men want to have. It makes them look more athletic, and if you take that away, it just softens and rounds the butt and completely feminizes it.
Exactly. Well, we call it a Brady butt, or we call it a body banging butt lift, which instead of rounding it off like for all the women, we keep it nice and tight. And actually, for a lot of these guys, they're already ripped. They don't have a lot of fat. So if we can not use that fat or even take from that fat, because in the lateral thighs and lateral glutes, there is a lot of fat. So we take that actually out and then we put it centrally. You can get even more
Right.
projection and really make a huge difference.
Well, very
and really
similar,
masculine.
very similar to ab etching. You know, kind of
Absolutely.
carving out the
It's
voids, taking
subtraction in addition.
exactly. I
Exactly.
want to take a minute, and we're going to continue right now. We'll go back to discussing this with the panel, but I want to just take a moment to let everyone know that in a little bit we're going to take a break before we do our contest. We've got a contest today. We're playing a game called Fella Facts, and if you want to play, my producer is going to put out in the chat of the different shows. We put it out on Instagram. We put it out in TikTok. We'll try and get the link out, so get you guys to come and join us in the green room. You get a special link to come on the show. If you want to come on the show, you'll answer 3 questions. Each of us have 3 statements. You're going to tell us true or false. And if you get 2 out of the 3 right, you're going to win a prize. We've got all kinds of prizes. We've got a Plastic Surgery Truths t-shirt. You'll enjoy some of that. We'll have I've got a signed book. We've got products like Nutrafol. I want to thank Nutrafol for sending this to be able to share in the show. This is a fantastic supplement for hair health, and this is specifically designed for men. We also have Definage products. We're going to get a men's kit from Definage that includes these products and more. And that's coming up. So take a look at the chat right now. My producer Tucker is going to put the link in there. We're going to get some contestants lined up, and you get a chance to win prizes. Let's get back to the panel for one last topic before we take that break and do the game. Hair restoration. I mentioned it before. Shino, I know you're doing that in the office now. Doug, you guys provide hair restoration as well.
Yes.
And you know, it's a really, really popular thing. We do a lot of it in my practice, and it was shocking to me to find out that only 2% of cosmetic providers actually do this procedure. It is such a great procedure. The results are excellent. You hardly see any donor area. Shino, what has been your perspective? You know, as a cosmetic dermatologist, you're doing a lot of additive procedures with filler. You're doing a lot of relaxing with Botox. When does it come up for you with your male patients, the hair transplantation? Because for surgeons, it's easier, because we're talking about surgical procedures all the time, and they say, hey, you know, what about adding some hair? What is the perspective of your average patient for hair restoration?
Yeah, actually, in my practice, I don't know, when it comes to hair, yeah, we have a service that comes and, you know, does the hair transplantation. But when it comes to patients, sometimes I feel a little bit like I let them tell me if it bothers them. With men, you know, when it comes to my female patients, I point it out immediately, because I feel like a female losing hair is something that is tragic for them. It's horrible, and I see the suffering. But when it comes to my male patients, I kind of let them. Maybe I'm doing the wrong thing. Could be more revenue to my practice, but I usually let them tell me what they can do for the hair, instead of me bringing the problem to them. Like,
Yeah,
by
well,
the way,
it's definitely different. I agree, but I think a lot of guys are shy. You know, Doug, you deal with lots of guys. I think in general they're shy to broach the subject, even when they're coming for surgical procedures for other things. It's as though they're not sure about the procedure. They're not sure who to trust to go to. So, you know, you're dealing with men all day long, every day. What do you think is really front of mind for them? What is the goal when a guy is looking for hair restoration?
They'll usually they are really shy about it, and you almost, I mean, we have different things throughout the office to have people have it, to ask about it, but they're afraid of it looking unnatural because they've seen so many horrible ones. They hear all the bad results, like you're alluding to, coming from another country, and they're afraid that that's what all transplants are, because this has happened. So we've had a deluge of all these people coming from Turkey, and not all of them are the best, and they don't look great, and so you see some disasters. And so people start to think, if they're new to this, and then if they're new to social media and hair transplants, start to believe that, all of them look like this. So we're fighting that as well. But yeah, people are really shy about it.
So, Shino, we're going to go to break in just a second, but I wanted you to speak to some of the, you're now really focusing your practice on rejuvenative, supportive care. And when it comes to hair, there's a few things that you can do to really support the growth and improve things. Speak to some of that. I know people are using PRP, exosomes. What's been your experience?
So we've been doing PRP for a while, but now we adding things like polyrevitalizing micronutrients. There are also platelet-derived growth factors, which is basically what you hope to get from your PRP. I usually tell people like, I just injure my knee, and they go, "We wanna do PRP." I go, "No, I want PDGF because my PRP is 56 years old and full of tequila, so you don't want to inject my PRP."
That's funny. Well, we should explain that because, if you're watching, PRP is platelet-rich plasma. When we draw your blood, we spin it down in a centrifuge, and then we re-inject it, and it's your blood, it's your plasma, and ultimately it's your platelets. And the reason you want platelets is that platelets carry in them these little bubbles called secretomes that carry growth factors and other little cellular messengers that can be very helpful, and it helps improve the health of the hair, the health of the scalp. It improves the thickness of the hair, and it has a lot of benefit. But what Shino's talking about being full of tequila is that the secretomes coming from you, or the platelets coming from you, will carry your biology. So, if you feel like maybe you haven't lived the healthiest life, maybe you're out partying a little bit, and maybe you're, over 50, over 60, when you really want to support your hair growth, maybe you're not the best person to be taking it from. And so there's new product, right, Shino?
Mm-hmm.
New product that is off the shelf and is engineered and, potentially has more potent examples of the secretomes and better growth factors.
Yeah, I think before and afters of and some of my colleagues that within 1 month there's a lot of hair growth. But we have a whole protocol. We will do that. We can put operations on dutasteride, finasteride,
Right.
Minoxidil. We have the red light therapy.
Yeah, which I love.
So it takes a village. A lot of times when patients get transplant, they think like, "Great, I have all this hair, and now I don't have to do anything until I need another one." No, you have to protect the native.
Yep.
The native will fall. So even if you get a hair transplant, you have to do all of these things.
Doug, your best tips for hair preservation? You see all these guys, some of them are getting into their 40s and 50s and not happy with what's happening. What are your best advice?
Well, we have the same things. We have the Nutrafol product lines. We have the red light. We have a follicular unit extraction.
Right.
And so we have all that. But I would say it's not only just for new listeners out there. It's not just for the hairline. It can be
right
for the beard. It can be there are a lot of guys that really want to. In fact, they're shaving their head while they're trying to grow a beard. That's where we are. That's where we are right now on social media.
In fact, we can take hair from the chest sometimes and use it in the beard. We can even pubic hair can be used if that's all we've got left. It sounds strange, but you can take the pubic hair, and it sounds weird to put pubes on your face, but that can happen. That can happen, right? And it can be very helpful. So you kind of take it where you can. We're going to take a break. I'm going to take this one quick break now. If you want to be a contestant, please put out something in the chat, DM one of our accounts. We'll try and send you the link. I've got some contestants lined up if you want to have a chance at joining us for the Fella Facts. We're going to be playing Fella Facts in just a second. We're going to be doing this one quick break. Again, be careful about where you're choosing your plastic surgeon. We're going to take a break, word from our sponsors, and then on to Fella Facts. Have you thought about getting a cosmetic surgery procedure but didn't know which doctor to choose online? Or maybe you're scared to go to the office, especially during COVID-19. It could be that you can't get the time off to go through a long recovery. Or maybe it's just too expensive to have the procedure you've always wanted to have. Well, I've got the solution for you. Introducing New Me Now.
You can call and order your favorite procedure and have it delivered to your door. Easy to use, no muss, no fuss, just open the box and you're going to get a new Me Now. With New Me Now, you don't have to worry about checking doctor's credentials or making sure the operating room is safe for you to use or even making sure you're healthy enough to have surgery. There's no surgery needed. Just dial our toll-free number, 855-NEW-ME-NOW, and you'll get your procedure delivered right to you. New Me Now is made in the USA. Whether you're looking for a breast augmentation, a tummy tuck, a facelift, any procedure you'd like to have, we have thousands of procedures in our warehouse just waiting to be delivered to your home so that you can have a New Me Now. The process is easy. Just call our toll-free number, 1-855-NEW-ME-NOW, and tell the operator the procedures you'd like to have. We'll prepare your procedures in our warehouse and ship them directly to your door within 1 week by express mail. Just take your package, sit back, open the box, and enjoy a New Me Now. How much would you pay to have your cosmetic surgery? $2,000? $5,000? Even $10,000? You can have a New Me Now for 3 easy installments of $19.95, plus $6.95 shipping and handling. But wait, don't order yet. There's more. If you pick up the phone in the next 30 minutes and dial 1-855-NEW-ME-NOW, we'll include a free gift certificate for an at-home injectable treatment. That's right, we'll ship hyaluronic acid injectables and neurotoxins for you to use at home with detailed instructions so you don't have to go to a pesky doctor's office to have injectables. Coming soon from New Me Now. What are you waiting for? Pick up the phone right now and call 855-NEW-ME-NOW. Get that procedure you've always wanted, and in just 1 week, you'll be enjoying a New Me Now. Nobody would ever buy a cosmetic procedure by phone for 3 installments of $19.95. If you would, you have much bigger problems to deal with. Make sure you see a board-certified plastic surgeon for all of your cosmetic procedures and follow Dr. Rubenstein on IG and at Dr. Rubenstein and at Plastic Surgery Truths.
We're back. I hope you guys enjoyed the commercial. Make sure you support our sponsors. You got to check out that New Me Now. Actually, if you watch that number works. Give it a call. It's worth the time. We're going to get now back to the show. We're going to be doing our game, Felifax. Welcome to Felifax on Naked Beauty Live. We have our first contestant. Let's introduce Andre. Andre, tell us a little bit about yourself.
Hi, thanks for having me. I'm from Miami. Well, technically I'm from Chicago. I've been here since 2003. I am a big component about male skincare. South Florida has trying to turn my skin into leather, so I appreciate you guys having me here because I'm always trying to pick up some facts and do what I can to preserve my skin.
All right, so we got to make some leather into silk. Dr. Steinbreck is going to read 3 statements. Since you're interested in skincare, I've got Definage. There's going to be a men's kit waiting for you. All you got to do is get 2 out of these 3 questions right? Just 2 out of the 3 right, and Dr. Steinbreck's going to take it away. This is on the line. So, Doug, let's see if he's been paying attention.
First question: if fat is removed from one area of the body, is it possible for it to come back to a different area that was not suctioned? A different area of the body. I
can't hear anything.
Oh, that's right. Yeah. Technically, I'm gonna repeat the question, Doug. So, if fat is removed from one area of the body, and then put into just removed, does new fat come to other areas? If removed from one area, does fat come back and go to other areas?
False.
False. Doug?
We're going to say true. It can come back. That's called rebound fat.
All right. Well, actually, you got that wrong, Andre. So the pressure's on. You got to get the next 2 right. Go ahead, Doug.
Got it.
Next one. Dermal fillers not only make a man have a higher cheekbone and a stronger jawline, but this can also make him look younger. True or false?
Dermal fillers not only give a man a stronger cheekbone, a stronger jawline, but it also makes them potentially look younger. Is that true or false?
True.
He says true.
That is true.
It is true. We need your bell.
There you go. Ding, 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 ding. That is true because as you age, you lose volume in your mandible. So it replaces the volume and can make you look like the younger person that you once were. Number 3?
Number 3. Let's hear it.
Number 3. Muscular. This is sort of where you're listening earlier. Muscular augmentation can be performed by either silicone implants or can it also be injected with fat cells?
Okay, now muscular augmentation can be performed using silicone implants or with your own fat cells. True or false?
True.
He says true, Doug.
That's true. 2 out of 3.
That's true. All right, we have a winner. He's got the 2 out of 3. The pressure was on Andre. You delivered. So
Pressure was on.
Tucker is going to get your information. We're going to get this kit, actually a kit just like this, an even better one, the full men's kit to you. Tucker's going to get your information. We'll make sure you get your Definage men's kit. I want to thank you for coming on, and we're going to continue. Doug, thanks for 3 great questions. We're going to go to Dr. Shino. Shino is going to come on, and he's going to read his questions. And let's get Gus on. Gus is going to be our next contestant. So let's get Gus. Give us a second. We're going to get Gus up here. And I want to thank Nutrafol for sponsoring this portion of Felifacts. Nutrafol is a fantastic formula. We use it for all of our male restoration, hair restoration patients. I strongly recommend it. This is specially designed for men who want to nurture the health of their hair. You need to take it. This is a 3-month supply. You need to take it for at least 3 months to really see the results because your hair grows really slowly. So check out Nutrafol if you're looking for any kind of hair maintenance, whether you're having hair transplantation or not. Shino's. All right, so we're getting Shino up here. There he is. There's Gus. Gus, tell us a little bit about yourself.
How you doing?
Hey, Gus.
I live in South Florida, by Fort Lauderdale, and I'm about to be 44 years old in 2 more days.
Hey, happy birthday, Gus. Let's see if we can get you some Nutrafol for your birthday. How about that? All right, so Shino, let's see. You've got your 3 statements. Let's see if he can get them right. 2 out of 3. You got to get true, false, right.
Okay, so the first one is, this is about loyalty, so pay attention, Gus. Women are more loyal than men
I
to
don't
their
hear the question,
aesthetic
though.
providers. True or false?
The question is, the women are more loyal. Remember, I've got to repeat the question for you. Women are more loyal than men to their aesthetic providers. Is that true or false?
False.
He says false.
That's true. Yeah, men are more loyal to
Men
the
are more
aesthetic
loyal,
providers.
so it is false. Women are
Yeah.
not more loyal. All right, now
They
you got it
they
easy, man.
cheat a lot.
It's a they cheat a lot. Women cheat a lot. How about that? I don't know. You make me worry about that now. All right. Well, all you got to do is answer one of the next 2 questions right, Gus. So go ahead, Shino.
Okay. Male patients worry more about their forehead wrinkles than their crow's feet.
Okay, male patients worry more about their forehead wrinkles than their crow's feet. Is that true or false?
So they worry more on their forehead than their crow's?
He's saying men worry more about their forehead lines than they do in their crow's feet lines. Is that true or
No,
false?
that's a negative.
He
That's
says
false.
Hey, he got it.
That is
All right.
false.
Well, you've already won your Nutrafol, but now let's go ahead and do the 3rd question just for fun. Go ahead, Shino.
Okay, so the last one is about Sculptra or polylactic acid, which is a biostimulator that happens to see results over time. So the question is, polylactic acid can stimulate collagen and elastin, but it takes too long to see the results. Therefore, it's not suitable for a man.
Okay. The question is talking about Sculptra, polylactic acid. Now, Sculptra stimulates your own collagen to grow, and it takes a while. So the question is Sculptra it takes too long to see the results, and therefore it's not a great choice for men. Are men too impatient to wait for Sculptra results?
I would say false.
He's saying false. What do you say, Shino?
It's false. Yeah.
That's false. All right.
false.
3 for 3, Gus. 3 for 3. All right. Well, we're going to get your information. We'll send over the Nutrafol men's supplement set. This is 3 months supply. and
Well,
I know that you'll have a good time maintaining your hair with this. Just watch your hair get thicker and more lush. All right, now it's my turn, and we've got our next contestant, our last contestant, Michael. Michael's going to come on, and we are going to be giving away with this one. Let me show you. We've got a Plastic Surgery Truths t-shirt. The truth will set you free. And Mastering Beauty. This is a book that features a number of cosmetic professionals from throughout the United States, and one of them in particular you may know. I'm in here. That's right, that's me. And actually, at the risk of being made fun of quite a bit after I show you this, this is, they came to the gym and actually did some photographs of me boxing, training in the gym. So, when the staff saw this, thanks. When the staff saw me, they were surprised. They thought it was a more ominous look than I've ever given them. Maybe I need to be a little rougher in the office. I don't know. All right, well, let me see. I've got my fella facts. I've got 3 fun fella facts, and this was actually mentioned on the show, so I got to see how much you've been paying attention. Okay. All right, so the first statement.
Well, do I get to say who I am?
Yeah, I'm sorry, Mike. Yes, please introduce yourself.
Come on, Doc.
That's right.
Okay. First of all, a tough act to follow. The other 2 guys.
It's true.
I'm Mike Kuznitsky. I'm attorney here in Miami. I'm sitting in my office right now, but I live on Miami Beach.
That's right. Well, thank you for joining us. I appreciate you giving us your time and watching the show. I'm so excited to get to these questions. These are fun. You get the. I think maybe I'm biased because they're my questions, but I think they're the best set. But here we go. You guys can decide. Here we go. And you had to be paying attention. This was actually revealed on the show if you were paying attention. True or false? Kanye West went to the doctor and got lipo with his money.
Trying to know what procedure he got. Lipo. I'm going to say true.
All right. That's true. Kanye West did publicly reveal that he had lipo. Okay.
But did he use money?
Well, that's another question. I bet he probably did. He's got plenty of it, or did at that time anyway. All right, here we go. Dwayne "The Rock" Johnson had rhinoplasty to reshape his nose.
He did not have rhinoplasty. That's false.
That's false. He did not have rhinoplasty. Bonus question: do you remember what he had done?
Let me think for a second. He had the procedure. That's the breast one. It's not the pec. It's the other one. The first one you mentioned. It's the I can't remember the name.
Gynecomastia. You're right.
Reduction of the breast.
That's
tissue.
right. That's right. Dwayne "The Rock" Johnson. The Rock had rocks removed from his chest. All right. And now, last one. Mark Jacobs had a facelift and showed the whole process on social media. True or false?
I'm going to say true.
That is true. All right. 3 for 3. Mike, great job.
Thank you.
So we will make sure we get a copy of Mastering Beauty. I'll sign it to you, and you'll get your Plastic Surgery Truth T-shirt to go with that.
I'd love to have an autographed copy of the book.
I promise you an autographed copy. You will have that. Thanks for joining the game, and thanks for playing Fella Facts. Well, we have come to the end of the show, and I'm going to just give each of our guests a chance to tell us where they can find you. Doug, you're in 3 different cities. Patients watching the show that may want to see the master of surgical male aesthetics, where do they find Dr. Doug Steinbrecht?
Yeah, the best thing is on Instagram, it's Male Plastic Surgery. You can see us on our YouTube site. It's Male Plastic Surgery as well. And you get a lot of videos there. It's really great referral for that. We've had that for 10 years now. And then our website is Male Plastic Surgery as well.
Yeah, so easy to find you. Just look up Male Plastic Surgery. It pops up all over the place. Shino, people can find you all over the world. If someone wants to come see you, you're here in South Florida. And if someone wants to come see you, how are they going to find you and try and schedule time to see you? If a man wants to come in and have their face rejuvenated, where do they go?
So they can find me at Shinobe at Yahoo. But I was giving my personal email. No, do not do that. I get enough of email.
You can get it from me.
At Shinobe. My handle in Instagram is at Shinobe. You can DM me, or you can go Shinobe Derm on Instagram and Facebook. And just so you know, I'm mainly doing these days bioregenerative aesthetic medicine and functional aesthetic medicine. So I try to get patients to get younger at a cellular level with biocollagen stimulators, fast stimulators, and polyfertilizing micronutrients. So if you're interested on getting younger from the inside out, then I'm your guy.
Well, if you're any testimony to your own services, you never age. I swear that you've got a painting in your attic that's getting really old and you're just staying young the whole time. I think it's how you're doing it. But, you know, I mean, we will, on future episode, I'll have you back, Sheena, if you'll come to talk about the biostimulation and, you know, the internal rejuvenation or prejuvenation. Try and maintain youth and vitality. So that's going to be on an upcoming episode. I want to thank everybody for joining us. Dr. Steinbrecht, thank you. Dr. Sheena Bay Aguilera, thank you. It's been a great show. Male Aesthetics. Happy International Men's Day. And thanks to all our contestants. And, well, thank you for watching Naked Beauty Live. We'll be back next month with a new show. Watch us every month, Naked Beauty Live, in your favorite outlets. Instagram, TikTok, YouTube, Facebook. Can't wait to see you next time. Thanks again.